I guess it was like somebody took a baseball bat and hit me in the stomach.
It took my breath away.
You're like a deer in the headlights.
It's not like you have practice for this.
I went through this whole trauma and drama thing.
When you hear the big C word, cancer, I always equated it with cancer equals death.
Most people, when they're given the diagnosis of cancer, jump into this sort of anxiety mode, and they get very anxious and they want their cancer treated yesterday.
A lot of times we think that we've got to do something right now, or that cancer is going to grow, like some kind of magic beanstalk.
One thing that people need to understand is that cancers that are diagnosed more than likely have been there for a long time and are growing at a relatively slow rate.
It's important to relax, take a deep breath. You have time to plan.
I told somebody that I had Hodgkin's disease, and he said his whole color sort of changed, and he said, "Oh my God, I thought for a minute you were going to tell me you had cancer."
Interestingly enough, I had never known anyone who had survived more than a year to 2 years, so I'm right away getting everything in order.
There are millions of people in this country who have been diagnosed with this disease and have finished their treatment and are living with the diagnosis of having had a cancer, but are living very fulfilling lives.
It's very frightening. It's very scary because you're like, what does that mean? They've said I have cancer.
Cancer, I guess, fundamentally is characterized by uncontrolled growth of cells, and the whole process in our body of cell division, cell growth, and ultimately cell death is very tightly controlled. And when that process fails in some fashion, that control system, then cells can start to grow in an uncontrolled way.
There are cancers of basically every organ system in the body, and of each organ system there are multiple different types.
Each different type of cancer will behave in a unique way, and so when you start to get a better understanding of your cancer, the questions that are going to come up are, what are my treatment options? And a lot of that will depend on how given cancers behave.
It's important to almost become a student of your disease, to learn everything you can.
One can go to any medical textbook in a library and various resource books.
There are certainly websites, there are books, there are pamphlets.
Cancer support centers that have libraries.
Group therapy, group sessions.
Support groups.
Social workers.
Hotline.
All of those things together, put together, is educational, and if you educate yourself, if you know all you can know about your particular diagnosis, if you understand it as much as you can, you're going to get better care.
It can be overwhelming unless you have a roadmap, if you will.
I mean, why go on a journey and not bring a map?
Education is empowerment, and looking back, the best thing I did for myself was to be hungry for information.
It never occurred to me to get a second opinion or anything like that.
I not only saw a second surgeon, but I also saw a radiologist and an oncologist.
I got 5 opinions.
Well, I think it's important to know at the beginning that it's absolutely expected, and that they're, first of all, not going to offend anybody. We assume that patients should and will get a second opinion.
And in fact, many insurance companies do require a second opinion.
For the most part, I think if it's very healthy for patients and their families to seek second opinions. Sometimes they just need to reinforce that, opinion that was given to them by the first physician that they saw. Sometimes there's differences that must be addressed. And again, some people have different ideas than others, and those ideas may be novel ideas that weren't thought of before. So I never discourage anybody from getting a second opinion, and most of the time I encourage it, especially if a patient is uncertain or anxious about embarking on a course that's been recommended for them.
In the long run, you are absolutely confident that you're doing exactly the thing you got to do to take care of yourself.
There is no one person who has all the answers, and no one person, whether it's a physician or not, who knows the proper treatment at all times. And I think second opinions are vital. I think third opinions are vital if there's still a doubt in your mind. And I think that the team concept is very important to the patient.
The whole concept of a multidisciplinary approach is to bring these various disciplines and various experts in each particular discipline together in order to discuss cases and plan a treatment strategy.
When we start to approach this more from a team aspect and you have a coordinator, that person can help patients get to the right place, help steer them through the process. And then at the end of the day, we can put all the information together as a team and make a group recommendation for a patient about what the options are.
The choices that are made about your care are going to be made not by one person, but by several people who come together in a special meeting of minds.
The team actually works together to give you holistic or complete care.
Everything is geared towards the patient and the patient coping with all these things that are going to be coming at them.
Perhaps there will be an oncologist, a surgeon, a nurse, a social worker, a person who is involved with medical genetics.
Certainly the nurse coordinator who will help the patients, nutritional support, psychosocial support.
The pharmacist, the nurse, the physical therapist, occupational therapist.
And involving not only family and friends, but perhaps clergy or other spiritual support to help really round out the team and give the patients the best chance to get through their treatment.
As we all know, 2 brains, 3 brains, 4 brains are better than 1. And each of us has a particular strength and a particular talent. And in a multidisciplinary setting, all those talents are pooled together, and it's really meant to benefit the patient the most. We don't always agree, but that's a healthy thing. And the discussion is carried on about the optimal treatment for each individual patient. And I think that's the key, is each patient is treated as an individual, because each diagnosis is an individual diagnosis.
So it's sort of a wonderful coming together of experts, all who are concerned about creating the best possible outcome for one patient. You don't have one doctor, you have a team, and they're all working for you.
You'll see people that spend more time, looking at how to buy a new car, okay, or a new stereo, than they will in trying to understand what the risk of their disease is and what their choices really are and how those choices can impact their outcomes. It's the hardest thing.
I was very, very active in the decision-making process of my treatment. Nobody made decisions for me. We worked together with my doctor, with my family, and I was very much a part of that decision-making.
All these people are there to help you, but they're not going to make this decision for you. You're going to make that decision.
I went into the doctor's office and said, you know medicine, but I know my body, and so I want to be a partner with you.
You need to figure out how you're going to treat the disease with all the modern technology that we have assembled in science.
I felt like I did the right thing. I had major surgery. I have about an 8 or 9 inch scar to prove that.
I had 8 treatments of chemotherapy plus radiation.
There are at least 5 different ways of treating cancer. The most common ways we treat cancer are the use of radiation, surgery, and chemotherapy. In addition to those 3 basic ways that have been around for a long time now, we use hormonal therapy, and we may use something called biologic therapy or immunologic therapy, which is a newer class of drugs and compounds that work by stimulating the immune system to help fight the disease.
There were a couple of different treatment approaches that were possible. And there was also a clinical trial that was underway. And I was viewed as appropriate as a subject in this clinical trial.
For most cancers out there, there is a standard of care.
When we say standard of care, what we mean is a usual and customary treatment pattern that is accepted by a majority of physicians and/or insurance companies that has been studied and is known to produce a certain result. What patients need to understand is that the result produced by standard of care may mean that it cures 90% of patients, or it may mean that it prolongs the life of patients by 5% or by a month. So the standard may not be what is optimal for you. And that's where clinical trials come in. Clinical trials are experimental or developmental studies designed to evaluate new cancer drugs or combinations of drugs with the goal of producing a better outcome. And the goal of the clinical trial may be to cure more patients, it may be to prolong the life of more patients, or it may be to achieve the same outcome as previous therapies with fewer side effects. The question is, when do you consider participation in a clinical trial relative to standard of care?
There really is time to make a decision. It's usually not a split-second thing. Certainly, when it comes to cancer, we want the person to sit down, look at all the treatment options, take their time to think about each and every aspect of it, and really understand it before they make that decision. Because you can't make a decision till you really understand each piece of it. And you certainly can't make a decision when you're feeling extremely upset and nervous about it.
You're going to decide upon your course of treatment. You're going to go through that course of treatment, and then there'll be new challenges that you face that are very individual based upon you and your lifestyle. And I would encourage you to plan for each phase, to anticipate the next phase. One way to do that is to come together with people that have been through the experience before you, but relax a little bit, and you'll find the resources to deal with it.
You start to think about losing a part of your body and what that's going to be like. Losing your hair, what's that going to be like? Is it going to grow back? And here again is where I feel, for me, the support groups were so important to me and helped me change my thinking and change the way I was going on in this. I mean, I saw people whose hair grew back, and I saw people who had lost a part of their body and they were doing fine. That, to me, you have to have hope.
One of the nice things about all these patients surviving the ordeal of a cancer diagnosis and surviving treatment, and especially long-term survivors, is that these patients are now in a great position to talk to others who have been given that diagnosis.
There is nothing better than talking with someone who's walked in your shoes when you're recently diagnosed. It's that support that you get, knowing that you're not the only one, and seeing other people who have been out of diagnosis for 10, 15 years. It is truly a way of feeling hopeful.
There's not one person that I've met that has had cancer that I don't have the utmost respect for, because I think of them as, soldiers. And so if you can get around a group of people like that have that same identity, then you're not going to be by yourself, and you're not going to be a victim.
I'm a cancer survivor and didn't have a group to be in. And so I'm absolutely convinced that it is easier to go through this if you have a support group than if you don't.
I must say the support group interaction completely turned my outlook around in terms of, I'm going to live, I'm going to make it. And I started living, I started working toward that goal and toward the time I would be through with my treatment and get on with my life.
It's all right to be scared. It's okay to be afraid. It's normal.
And once you can accept the fact that there's this new factor in your life, then you can deal with it, and then you can move on from it.
I always tell patients to understand that there is a life after this diagnosis, and that life can be one filled with hope and joy, and we need to first start with understanding what we're up against, what the options are.
Make sure you feel comfortable with the course of treatment and with your physicians, because they're your advocates.
And really look at what you need to do, who you need to help you do it. And doesn't mean just docs, but support people, you know, the people that care about you.
And once that happens, I really work to assure patients that that sense of anxiety can start to go away. And as you have a game plan and as you're moving forward, it becomes a process that one is going through, but it can be one that's a very hopeful process.
Because I am a survivor, and it has been 13 years.
I'm here 14 years later, so.
I can tell you that 3 years later, after my, diagnosis, I'm stronger, more balanced, and have grown.